This segment of DelmarvaLife is sponsored by TidalHealth.
We are officially in the month of November, and it's a month that we typically associate with cooler weather, cozy sweaters, and maybe a few too many pumpkin spice lattes. November is also a time to shine a light on a part of our health that doesn't really get a lot of attention.
That's right, it's Bladder Health Awareness Month, and today we're sharing a reminder that what's going on down there deserves just as much care as our hearts, lungs, and any other organ. And joining us to reinforce that reminder is Dr. Peter O'Hara with TidalHealth Urogynecology. Thank you so much for being here today.
Welcome.
Well, thank you for having me. I appreciate it.
So you're new to TidalHealth. Tell us a little bit about your background and your professional interests.
I am. I just joined TidalHealth about a month ago, and we're spearheading a women's health initiative with TidalHealth. And urogynecology is a particularly needed specialty in the area. Urogynecology, I like to explain it in non-medical terms. It's sort of like I'm a carpenter, plumber, and electrician for your pelvis. For women, of course.
Yeah, yeah.
And what this means is I deal with support issues, nerve and muscle function, and organ dysfunction, such as bladder or bowel.
Okay.
Our specialty is a subspecialty of obstetrics and gynecology. So in my training, I did 4 years of residency for OB. I delivered babies. And then I did an additional 3 years of surgical training for urogynecology.
Okay. So how would we know that we need a urogynecologist?
So the symptoms that we deal with typically relate to bladder dysfunction. For instance, it could be urinary incontinence, could be recurrent urinary tract infection. It could be a feeling like, I gotta go, and you run to the bathroom and maybe you don't make it there in time. Additionally, there's things called pelvic organ prolapse. This is where women who've given birth or been pregnant, the organs may have fallen. And this can be pretty distressing for a lot of women. Additionally, we deal with bowel dysfunction. So we combine gynecology, urology, and colorectal and treat these disorders together.
So we mentioned November is it's the awareness month for bladders, and we joked around that we're always aware of our bladders.
Especially as we get older.
Right,
Of course.
But there's more to it than that, and that relates
right.
to your field as well.
Well, I think we're trying to bring the conversation to the forefront. It's not a typical dinner conversation to talk about your bladder or accidents that may happen, or feeling like you don't want to leave your home. We have women who isolate themselves because of these disorders. So we want to kind of bring the issue to the forefront with your primary care doctor, with your gynecologist, or you come to see me. It's not just incontinence. It could be, like I said, urinary tract infection. It could be pain, and you just don't know what's going on. So sometimes a visit can help educate you as to what the problems are and maybe find a solution.
I know a lot of women, as they get older and start exercising a little more, they kind of find out what is going on with the bladder floor, the pelvic floor.
Pelvic floor,
yeah,
right, right. So these pelvic floor disorders, they can really limit your activity. And I mean, the month I've been here so far, I have so many women who actually have to change their lifestyle, avoid exercise, for instance, or avoid playing with their grandchildren because they're afraid of something happening. So even though it's only lifestyle problems, I think they're still important, and we should seek a solution.
So when it comes to folks' bladders health, is there anything that they should look for other than pain or things like that that maybe might be a sign of something?
Right, so I see a lot of women who will have urinary tract infections, for instance, and dismiss them, and 1, 2, 3, 4 a year. That's not normal. I think any type of urinary incontinence isn't normal. For years, women have been told, well, that's what happens after a baby, and you just deal with it. And that's not true. So I think these are issues that you can seek help and bring it to the attention of your primary care doctor, for instance.
And they will refer you to, or them to you.
Yes.
Dr. Peter O'Hara with Urogynecology at TidalHealth. Thank you so much for coming in and talking about something we don't normally talk about, but
Well, thank
should.
you. Thank you.
Absolutely.